Breastfeeding is natural, but it does not come naturally. In the olden days, young girls grew up watching their mothers breastfeeding their younger siblings or other mothers breastfeeding their babies. Nowadays, most young adults were not breastfed. Their mothers are unable to help or advise them because they never breastfed their babies themselves. Hospital stays these days are very short, so learn as much as you can from the nurses before you go home. Breast milk is specially designed by nature for babies. It is all the food baby needs for the first 6 months. Breast milk contains enough water to quench baby's thirst. Breast milk is also known as a living liquid. Unlike formula milk, which is always the same, breast milk is dynamic. It changes with the age and the needs of the baby. It also contains antibodies to protect the baby. Nature has a wonderful way to accommodate. When babies are born prematurely, the breast produces milk which is just suitable for them. Mothers can start to collect her colostrum within 6 hours after delivery or as soon as she is able to do so. The earlier the baby receives the colostrum, the better protection they will receive. Colostrum is in the breast from as early as 16 weeks of pregnancy for most women. It is a very thick, concentrated liquid rich in carbohydrates, protein, and antibodies. Transitional milk comes in around 3rd and 4th day after delivery. The milk is thinner and increases in volume. By 1 week to 10 days, most mothers would have produced an established milk supply. The composition of the mature milk changes during feeding from the less fat fore milk to the fatter hind milk. It is important now that mothers let their babies suckle on the first breast till it feels lighter and softer to enable the babies to receive the hind milk. This satisfies their hunger, helps them to sleep longer, and to start gaining weight. There are many benefits of breastfeeding. For the babies, it is an ideal food. It contains antibodies to protect baby's health, growth factors for development, and always at the right temperature. For mothers, breastfeeding is convenient. Breast milk is always available any place, anytime. Protects her health, lowers risk of cancer of the breast, ovaries, and uterus. It also lowers risk of osteoporosis. Releases hormones to contract the uterus, thus reduces blood loss in the postpartum period. For fathers and families, it is economical, it is free, babies are healthier, thus less medical bills, they recover faster from sickness, so shorter hospitalization. It is also time-saving, no preparation required. After washing your hands, find yourself a comfortable position. Massage your breast to stimulate your breast to facilitate the let down. There are many ways to massage the breast. Here is just one simple technique. Support your breast with one palm at the bottom and place the other hand on top. Now with slight pressure, move your hand left, right a few times. Then turn your hand to the side and move up, down also a few times. Cradle hold. Support your baby's shoulder and neck at the crook of your elbow. Your lower arm support the lower part of the baby's body. The baby's buttock rests in your palm. Turn baby's tummy towards you. Hold the breast with the other hand and bring the baby to you. Cross cradle hold. Support your baby by placing your elbow behind the baby's buttock. The lower arm support the lower part of the baby's body. With your thumb, Place behind the baby's upper ear and the index finger behind the baby's lower ear. Baby's tummy is turned to you. The other hand support the breast, bring baby to the breast. Football hold. Place a couple of pillows behind your back for support. Have a couple of pillows on the side where you're going to hold baby to support the baby. Now, hold your baby by placing your elbow behind baby's buttock, the lower arm supporting the lower part of the baby's body. Place your thumb at the upper ear of the baby and the index finger the lower ear. Now, bring baby towards your back. Hold your breast and bring baby to the breast. Side lying. Lie on your side on a firm mattress with a pillow to support your head. Stretch out your lower leg, draw up the upper leg. Place a pillow between the thighs for comfort. Tilt the nipple of the lower breast to about the height of baby's mouth. Bring the baby to the breast. The baby is also lying on its side with the tummy to you. Always support your breast with a free hand. Using the C hold will give it a better support. The baby should latch on the areola or the dark part of the nipple. Always bring baby to the breast. Babies are free to move. Breasts are fixed. If mother goes to baby with the breast, she may end up in a very outward position and may cause backache. Support the breast about 2 cm away from the base of the nipple. Lift the breast up. Place the thumb above the nipple so that the nipple sticks up. Tease the baby's mouth with the nipple. As soon as the baby's mouth is wide open, like yawning, bring baby quickly to the breast. Only let go of the breast when the baby is well latched on. Signs of good latch or milk transfer. Baby's cheeks are rounded when suckling. No sucking sounds are heard. Distinctive suckling pattern. Suck, swallow, breathe. Lips flange with head slightly tilted back. The nose is free. Swallowing sounds can be heard when the milk is in. Mother feels strong tugging of the breast but no pain. The breast feels lighter and softer as baby drinks. Most babies will come off the breast when they have enough. Some babies don't. These babies need suckling for comfort. When the baby has enough, he will change his strong suck, swallow, breathe pattern to just nibbling. To break the suction, simply slip the little finger at the corner of baby's mouth. Try to get the finger between the baby's gums. Only remove the baby from the breast when he has let go of the breast. Cradle the baby for comfort. May take 20 to 30 minutes before you can put him down in his cot. The baby is sound asleep when there is very little or no more eye movements observed. Babies are breastfed on demand, that is whenever they are hungry and not whenever they cry. Remember, babies will cry for many reasons. Some babies are very demanding, especially during the first 2 weeks after delivery. Initially, some babies are very demanding, especially during the night. So it can be very tiring for mothers. Once the milk supply is established, baby drink more and the frequency will lessen. Babies usually want to be fed every 2 to 3 hours. The hunger cues. Baby wakes up, start licking the lips, getting a little restless, searching for the breast with their mouth, pacifying and comforting themselves by sucking their thumbs or fingers, crying as a last resort to attract attention. Start expressing and storing your milk when the baby is 6 weeks old. The breasts are never really empty even after breastfeeding. You can start expressing and storing your milk after you have nursed your baby. Store only the amount of milk baby needs for the day while you are at work. Discard whatever is left over. Do not refreeze. Storage duration of a freshly expressed breast milk. At room temperature, use within 4 hours. Refrigerator 0 to 4 degrees centigrade, use within 48 hours. In the freezer within 3 months. Thawed milk in refrigerator, use within 24 hours. Warmed up milk, use immediately. Discard all leftover milk. Do not refreeze. Here are some key points to remember. Have patience and perseverance. Wash your hands before breastfeeding. Choose a comfortable position for yourself. Hold baby in a comfortable position. Listen to some relaxation music helps with the let down. Ensure baby latches well and is drinking and not just sucking. Break the suction if necessary. Collect and store your milk from 6 weeks on. Continue to breastfeed or pump regularly to maintain abundant supply.